Alright class, today we're going to be learning about Tourette Syndrome. Now this is important to me because I have Tourette Syndrome, and so I want to teach the future teachers about something that can be implemented into classrooms and that a lot of kids have. Now, I want everyone to raise their hands just before. Does everyone have social media, TikTok, Instagram, Snapchat? I do. A bunch of you guys. Okay. As expected, a lot of people have social media, and in social media you see a lot of people with Tourette's, but not all of it's true. So what do y'all think is Tourette's by just looking at social media? Anyone want to raise their hand? Bailey?
It's like things happen you can't control.
Yes, so those are called tics, and a lot of time on social media people fake tics, and it's really unfortunate. So I'm here to tell you what is actually real. Not okay, activity time. I need 2 volunteers. Now you can probably guess with tics, it's kind of hard. So we already know that tics, it's in this involuntary movement, which we'll get into a little bit. But Bailey, you'd like to be our volunteer?
Yes.
Okay, we're actually gonna need 1 volunteer. Well, actually, no, we can do 2. Bailey, you can sit or stand right there. Volunteers. Macy, you can also come on up. Essentially, the purpose of this activity is we're going to be doing a cup stacking, and with tics, obviously, I might not be doing a cup stacking activity every day, but basic things like writing, I might throw my pencil, so I kind of want to show you all that. So, Bailey, you're going to have these cups. 4, 3, 2. Okay, there's not one on top, but it's going to be 4, 3. Oh wait, I don't know why I'm stacking for you. Ignore that. It's gonna be 4, 3, and then 2, because we don't have one on top. You're gonna try to build it as fast as you can, and when I clap, you're gonna throw it to Macy. If Macy doesn't catch it, she throws it at your head. Are you comfortable with that?
Wait.
So,
Shoot. Can I keep on going?
yes.
Where'd it go? Under the chair. Under Heidi's chair. Oh. Hurry, Bailey, go. I'm trying.
Okay, you concluded. Round of applause for Bailey. Okay, obviously that was very much an exaggerated. I'm not throwing a cup back at Macy and she's throwing it back at me. That's probably not going to happen, but I wanted to show y'all guys that it was hard to do the cup stacking, right?
Yeah, boy.
Yes, so it does interfere with things. Obviously, I don't throw things at people, and Macy won't throw things back. Y'all can go head back to y'all seat. I just want to do the activity to show you guys that it is hard to have tics and have these sudden movements. What is ticking? Y'all kind of know this. Ticking is an involuntary movement of movements or sounds. So it can be like with my voice, or it can be just like a head jerking, or like moving my arm or something like that. The main symptom of Tourette's. Now, you have to have tics to have Tourette's, but there's other symptoms of Tourette's, which we'll also get into. It can be either vocal or motor, can be complex or simple, and it's an uncontrolled movement. If you're going to be a teacher in the classroom, know that you can't just tell them to stop doing that. Simple tics is blinking, shrugging, shrieking, head jerking. This isn't like what you see on TikTok, like jumping up and down and running in circles. If that does happen in a case of Tourette's, that is a very, very severe kind of like top of the spectrum kind of thing. That is not normally the case. So to hear simple tics, complex tics, like I said, jumping like the highest, like not normal, touching your nose, kind of a more complex tics because that's kind of very like hand-eye coordinate. Cursing, which is coprolalia, we'll get into it, echoing words of others. Now there's also a rare one. Coprolalia, that is what you see on TikTok from people cursing, which is only 1/10 of people with Tourette's. Say with me, it's 1/10 of people with Tourette's.
1/10 of people with Tourette's.
I want to make that very clear. It is not a very common thing, which a lot of people think it is. But if there is a kid in the classroom that has coprolalia, that can be really hard, especially if it's elementary school or middle school. A lot of kids' parents don't want them to hear those things, but they can't help that. So we kind of have to be creative as teachers. How does Tourette's work? It's neurological, dealing with the nerves and the wiring of your brain. People think it's the neurotransmitters in your brain, which is like sending dopamine, serotonin to different parts of your bodies. But when you have Tourette syndrome or a tic disorder, it's sending false signals. So it's like a rush of dopamine or rush of serotonin that can also affect you mentally, but it's going to different parts of your body. So it's unable to properly communicate with nerves. The basal ganglia is where this all happens, because the basal ganglia is responsible for movement. So it's the neurotransmitters that are sending these signals back and forth, but also communicating with your basal ganglia in a false way. So yeah, it's going through the different parts of your body through the basal ganglia. on this topic, tics can be triggered by emotion. So sometimes it's when you're nervous or really overly happy. That's kind of the theory with the dopamine. When you're really happy, a lot of people have tics. Depression, suppressing, holding it in, tic, or postponing it. Feels like holding your breath. Co-occurring conditions, most common co-occurring conditions is ADHD and OCD, which remember OCD is not a cleaning disorder, it's an obsessive compulsive disorder, which can cause more impairment than the tic itself, especially when kids are suppressing in a classroom. So you want to create an open space for these kids to be like, hey, it's okay to tic. I'm not going to judge you, and these kids are not going to judge you. That's very important. Other problem, tics hurting. Me personally, I have a tic that goes like this, and I have neck problems now at 15, which is unfortunate, but some tics can hurt, not the main problem, but it's a thing that happens. Social media stereotypes, this is a humongous one that I've kind of talked about throughout this whole duration. Frustration, sometimes I get really frustrated if I'm doing something, especially at home, I'm doing homework, and then I scratch my pencil on the paper and I create a line. It's frustrating even after a hard day. Feeling different. How we can help. Education, what I'm doing right now, supporting people with Tourette syndrome in the classroom and social spaces. Medicine does help. No one should be required or feel compelled to take medicine. A lot of people do take medicine, like I do, and it helps a lot with Tourette syndrome to stop ticking. And accommodations. Now, accommodations in the classroom, ones that I think off the top of my head, kind of hard, but honestly, it's just not letting the teacher point it out in the classroom. Because unfortunately, as a high school student, it happens a lot. But seeing people with Tourette's, be patient. If it's a really severe Tourette's, if you're having a conversation with someone, they're gonna constantly be ticking. Don't ask if they're faking. It's a big one, because a lot of kids when they're younger, kids move around, kids are squirmy, and they say oh, I can't control it. But a lot of kids actually cannot control it. So just don't ask if they're faking. If it's a little kid, a big kid, just anyone. Show acceptance. Just show that your mutuals respect. Frequently asked questions. This is kind of about the driving and stuff that you were saying. Can you drive? Yes, but it varies. For me, I can drive, but there's a possibility of me ticking, so you are more at risk of a car crash to live with. Can stress or anxiety make tics worse? Yes, again, it varies for everyone, but the most part, any strong emotion can affect your tics, whether it's sadness, anger, happiness, any strong emotion, depending on your sensitivity. Do tics affect sports? Yes, it's going to make it harder, but for the most part, it will not affect whether you can do the sport or not. Performing arts is very hard, but if you're playing volleyball, it might just be a little twitch of the head. For the most part, it doesn't affect it, but there is some severe cases. Let's see what you know. I want everyone to stand up. I know it's 7 in the morning, but we're going to stretch a little bit. This side over here will be true, and this side over here will be false. Okay, we're going to do true or false to kind of test what you know before we go into our independent practice. Okay, true or false? Most people with Tourette's curse or use inappropriate language. True or false? All of y'all went to false. This is false. Oh, we're going to the next question. That was false. Medicine can help people with tics. True or false? That is true. Y'all are all correct so far. True or false? If you tic, then you have Tourette's. True or false? You are all correct. True or false? Most people commonly have complex tics, which is what the touching to the nose, stuff like that. True or false?
Oh, this is false.
Okay, you are all correct. Oh, what's happening? Okay, everyone can go back to their seats. Now we have our independent practice. Please open up your Chromebooks. There will be a Google form in Schoology. It's titled Caitlin's Google Form. Since both of you have submitted it, I'm going to pass out these note cards, and you're going to answer both of these questions. The first one is how will you use the information you learned throughout your life, and tell one thing that you learned today that you didn't know before. Now, throughout your life, bonus points in your teaching career. I know we do want to be teachers. I'm going to pass these out. Since most of you are done, thank you so much for participating in this lesson. This really helps me out a bunch, and thank you for learning about Tourette's with me.
Yay!